Clinical Telehealth. This is Melanie Bell. We are located on the same floor as ICU. Is anybody familiar with telehealth? You are? What do you know about telehealth?
I did my fellowship in the VA, so I did it for groups and couples therapy.
Fantastic. So telehealth for the VA is bridging the gap between veterans and healthcare. What we do is a provision of clinical care using a variety of technologies such as video, teleconferencing, telephone care, and snapshots of clinical images. So we take pictures of derm issues, we take pictures of retinal diabetic screening as well. Telehealth services can provide care that current sites can't provide. So we have a number of providers that are located in Wenatchee, Seattle, Portland. We have a few providers that are located on the East Coast as well. This cuts down on likely travel for veterans, and it also can occur at the closest clinic to the veteran. So if we have providers here in Spokane, some of our veterans go to the clinical C-Box down in Coeur d'Alene, Wenatchee, Sandpoint. I'm not quite sure if Republic is still open. I think Republic closed. So we provide the right care, the right place, the right time. And just some statistical information regarding telehealth. 2014 report from Research and Markets stated that the global telemedicine market will have a compound annual growth of approximately 18.5% by 2018. That's up from 350,000 patients being seen annually to 7 million patients. Currently, there's approximately 46 bills in legislature that are pushing the continuation and growth of telehealth. A lot of that is, of course, related directly to the VA. The different types of telehealth that we do, here's clinical televideo health. So what we have are carts that have blood pressure monitors on them. So providers that are in other areas are getting real-time feeds of vital signs. We can do total exam cameras, so we can get those up-close personal pictures of the wound care, vascular care, that kind of thing. Home telehealth is a different department than us. Our home telehealth nurses work from home. They monitor patients' diabetic care, blood pressure care, so they can manage hypertension, they can manage different medications, and they do all that through the machine, the blood pressure monitoring machines. All of that's transmitted via telephone or internet. Here's some dermatology. We take pictures. We send those over to our Seattle providers. They get back to us. They have a 7-day turnaround. So if you as a provider, I don't know how many of you are providers, send us a patient that has a critical dermatological issue, we're going to take those pictures. We send those over to Seattle. Seattle has 7 days to get back to us. We give you guys an additional 3 or 4 days to go through your consults and do your follow-up. And the patient is cared for, has their plan of care, and is starting treatment within a 2-week period, versus the wait time for our dermatology department right now is 3 to 4 months to even get in for a consult. Teleretinal imaging. So right now we have a clinic up on the 5th floor where we do non-dilated procedures. We take pictures of the retinas. We do 8 views. We send those over for screening, and it's literally just a screening exam. We're also opening a clinic, telehealth is, in the eye clinic, where we're going to do dilated exams as well. So the patients that we can't see upstairs because we don't have an on-site provider, we can see over in the eye clinic and dilate. So everybody's getting trained for that as well. Store forward, that's where we take our dermatology pictures. We take the pictures, we send them forward. We also do this for plastic surgery follow-ups. If a patient has had plastic surgery for any reason, whether it be cosmetic or a post-surgical, from Seattle, they can have all their follow-up care done here. So they can monitor all that. Again, a couple examples of store and forward. That's what our retinal machine looks like. So we're doing that retinal imaging in a dark room. So we have one specific room designated just for that. CBTs, we do Skype appointments basically. So we have mental health, we have comp and pen evaluations. We can send a patient here from, let's say, Coeur d'Alene. They can see a provider in Seattle for arrhythmia issues. Vascular issues would be considered under the CBT. We have all that fancy equipment. Mental health. Primary care also has a cart. They'll be able to have patients. I think our last clinic was in Boise. So we had a provider in Boise that was covering for the lack of providers here. seeing patients via the clinical telehealth, and we had a nurse that worked directly for that program, and I believe they're getting ready to start that up again. These are the different CBT clinics that we have. So amputee, arrhythmia, comp and pen, heart transplant, infectious disease, liver transplant, mental health, neurology, OEF, OIF, OND, pharmacy, plastic surgery, primary care, pulmonary, thoracic surgery, SATP, vascular surgery. We also do educational classes. So we teach things like diabetic management, diabetic nutrition. We do what's called a MOVE program. It's teaching our diabetics how to get up, get exercise. They provide pedometers, they provide any kind of educational resources. Pain clinic, Parkinson's clinic. So we do a quarterly Parkinson's or movement disorder education class where people are free to come in and bring their family members or caregivers, and there's a 3-hour session on that. Renal, smoking cessation. All of these clinics can be, again, tapped in from the CBOX or the rural health clinics so that patients can attend at their leisure when they need to. Tele-ICU is not part of our actual clinic. That's going to be located on 5 South, the other side of the hallway. That's located in our ICU. And that's basically, it's nurse-driven rapid response program where nurses and interventionists, physicians in Minneapolis can respond real-time through a hotline. They use video teleconferencing to provide 24/7 monitoring of ICU patients in critical care management. They can help answer questions, give advice, give expert consultation. According to the Critical Care Nursing Journal of 2014, tele-ICU is a second pair of eyes that provides additional support by collaborating at the bedside team. Tele-ICU can support care without distraction, deliver timely interventions when minutes make a difference. It's basically layman's terms. Home telehealth, again, all the nurses from home telehealth work from their home as well. That monitors, manage veterans with chronic diseases at their home in order to improve clinical outcomes and access to care, and supports and complements the care by our primary care teams. The goal of home telehealth is to provide clinical outcomes and access to care while reducing complications, hospitalizations, and clinic or emergency room visits for veterans in post-acute care settings and high-risk patients with chronic diseases. And those are just a couple of examples of the monitors that they use, just your standard blood pressure monitor, but as you can see, it's going to attach to their phone port or internet. And this is what they deal with. They do diabetes, CHF, COPD, hypertension. They also do the MOVE program in conjunction with CBT and the Quit Tobacco. That's all done by individual voice response system. And these are just a few of our pieces of equipment that we use. So you're going to see these all over the clinic even if we're not using them directly. If you ever have any questions on how to operate or you want to learn how to use the software and the programs, call up to the 5th floor. We are happy to give tours, explain everything. All the webcams on site we also manage, so if you are sitting at a specific spot and you're going to need a webcam for your everyday activities, you'll call telehealth, we'll come down, we'll install it, we'll get you set up with what's called a Jabber account. That's our way of communicating. Digital cameras, we just use standard Sony CyberShots for our dermatology pictures, and it's the software that makes it super special. You'll also see the teleconferencing systems everywhere, and sometimes, depending on where you're located, you might see the Tandberg, and that's the one that's hooked up to your phone monitors. And this is who you contact if you have any questions. This is a home telehealth list of RNs. All these lists are ever changing, so. And that's it. Any questions?
What is the acronym OEP/OIF? OND?
OEF is Operation Enduring Freedom, Operation
Iraqi
Freedom, and OND is, come on, help me here.
Operation New Dawn.
Oh, well, thank you. I didn't know
Oh,
that.
okay. I thought it was like I thought it's the person.
No, so
like,
what they do for a lot of that is they do peer support.
okay.
I'm not quite sure, I'm not familiar with those particular departments, but there will be speakers come in that we'll talk about that. Anything else? No? Okay, well, welcome.